in the emergency room, we would see patients and they would not be what we call compliant with their instruction. Well, it's not non-compliance, meaning they decide, I don't want to do that. There could be many reasons.
Not everybody is thinking long-term. If you're day-to-day and you're just trying to survive from a day-to-day perspective, like, are you thinking 3 months, 6 months out from here, a year from here?
In our communities, we also have this underlying theme of mistrust. And some of our access may be limited by our impressions of what that access really is.
Think about my dad, who was a machinist at McDonnell Douglas, very focused on providing for the family. And for many years, he was ill and he didn't necessarily take the time to connect to any sort of resources to help him. He would collapse, he would go to the emergency room or to get care and then return to work and never tell us as a family. I think about that when I think about Black culture. Even if we have access to health care, right? I don't know that we are taught, and it's not necessarily within our culture, to take care of ourselves.
We go through life and we plant seeds, right? Some of those seeds are trauma. Some of those seeds are, medical conditions. There's a lot that happens to a person. And if you only focus on trimming the branches and you're not getting to the root of the issue, you can't be surprised if those issues spring up in other areas of your life.
I'm excited by the intentionality with which our leadership speaks about health equity being part of our strategy.
And I do think our biggest opportunity will be to not only encourage, but to educate all community as to what really makes the difference, what feels good. How will you have lived your best life and achieve wellness?